There are certain situations where we don't get the whole picture when a patient's sitting in our office.
White coat hypertension is stage fright. You're going to a doctor's office, you don't want to hear bad news, you get anxious. What happens? You have that fight or flight response. Everybody has it. It's like that stage fright you get. You have sweaty palms, your heart starts beating faster, your vessels contract, your eyes are dilated, and your blood pressure appropriately goes up. And that's the reading we get in the office.
Where a patient may be more nervous or may have a tendency toward a high blood pressure when they're sitting in a doctor's office, but in their regular life, their blood pressure is okay. And you don't want to be treating a blood pressure based on just one or two numbers if the reality is that a patient's blood pressure is well controlled.
You may notice that your blood pressure in the office is perfectly normal, but then your blood pressure at home is very high, and that's something called masked hypertension. These are patients we're going to want to closely keep an eye on because they are at a little bit of a higher risk of having elevated blood pressure in the future.
So I actually recommend blood pressure monitoring at home for many of my patients. Either in patients where I am really not convinced that the blood pressure is accurate when they're in the office, or in a patient where I'm not getting a good picture of whether there's a big fluctuation between times of day, for example, and they're only in my office one time of the day, but I have no idea if the blood pressure is going higher at night or lower in the morning. I want to get a better sense. And I can do that by asking a patient to check their blood pressure at home, and I can tell them specifically the time of the day or the times of the day that I want them to check and report back to me.